I'm gonna let my ladies introduce themselves so y'all can get a feeling on what they do. Cause yes, these are professional ladies and they do the damn thing. Yes. Ah. Okay, Shaniqua, you go first.
Okay, I am Shaniqua Moray. I am a jack of kind of most trades. I'm a retired chef. I am a retired clinical administrative coordinator for the state of Florida. Um, well, not retired, I just don't do that job anymore. And I am an independent consultant and project manager. I am also a international public speaker,
Yes.
and that's it.
That's what I like. That's what I like most about what she do. Like she speaks, she travel, like she do the damn thing. Okay, cousin, you go ahead.
Okay. So my name is Dr. Lady Fire Jones, and I am the owner of Complete Dimensions Wellness Center here in Jacksonville, Florida. I am a native of Jacksonville, Florida, and I have a couple of different partnerships with organizations here in town. So not only do I provide mental health services, but I also provide STD prevention services here in the community. Those partnerships are with First Coast Community Development and also Operation New Hope.
With Operation New Hope, what do they provide? Like what services and stuff do they provide? Cause um, I know they do a lot of stuff, but
So Operation New Hope actually is a nonprofit organization here in our city, but it's also located in other locations in Florida, and they provide a reentry program for people that's recently been incarcerated to help them reenter back into society,
put
basically
your phone up
providing
here.
them with their basic needs of housing, employability skills, and the services that I'm providing them are mental health services and also STD prevention.
Okay, that's good. That's good. That's good. I looked up a few places that people are. It's a lot of places that individuals can go to get free HIV/AIDS testing, STD testing, and stuff like that. But I kind of wanted to list and name a few because they have the clinics, they have the health department, and then they have a couple private places as well.
So yes, so there are a number of places in Jacksonville where people can go get free STD testing. One of them is First Coast Community Development, is where you can get free STD testing. AHF is one. The Salzbarger Center, and then there are satellite places also that's usually around town that have mobile units. But I will say that I'm proud to say that First Coast Community Development is the number one in our city in prevention. So we don't treat HIV, but we are number one in prevention of HIV. And we know that because they come to us because we got the numbers.
Okay.
So we know that we are number one in the city and looking to be number one in the state as basically, you know, we cater to the community because this is something that is plaguing our community. Um, Basically, women, number one
Mm-hmm.
in African American women,
Mm-hmm.
number one in new cases in the state, and Jacksonville is number two in highest of new developed HIV cases.
Right.
So with that, we are basically trying to make a dent in new cases. We want to be able to say, hey, guess what? If you get on PrEP, guess what? You ain't got to worry about it. Or if you go ahead and get PEP, hey, you have a intimate something something. Hey, guess what? You can take this in 72 hours just like you would a plan B pill, and guess what? Now you don't have to worry about having a lifelong
Okay. So what I want to address right there is the prep and the pep, because I don't want people mixing the two up. So the PEP, right?
Yep.
Okay, that is within 72 hours, meaning you take it 72 hours after knowing you've come in contact with somebody with HIV.
It's also important for people who have possibly been sexually assaulted to not wait. I know you're scared, you want to go through your emotions, you're
Take
thinking,
precautions.
but you take precautions. If you go to the emergency room within those 72 hours, they will give that to you for free. Well, I don't know what the insurance will do, but they can't not give it to you. So that's really important because you don't know who your person who assaulted you. You don't know their history. So if you do what you can as a proactive, you don't have to worry about that.
Okay, good. So prep is the post like.
PrEP is something that you can take as a preventative method. So if you start dating someone who is HIV positive, but you like them, you love them, you want to be with them intimately, PrEP is something that you can get on. You need to be on it for at least 14 days, but you can take that as a method so that you cannot get the virus sexually. It's important to know only sexually, of course, blood to blood, anything like that, you will be affected. But PrEP is something as a preventative method while you're dating whoever, or if you're just in the lifestyle of multiple partners, it's no shame. You can do that, but it's not to be used as just, okay, well, I don't have to ever wear condoms or anything like that. This is just for this specific virus.
And I think everybody should protect themselves and should act as if everybody have it. And it's something that we as people don't do often. We don't get, test results. We don't go down there onto the little vans and shit. We don't go and get tested as we should. We just go start having sex. And sometimes it's unprotected sex. But I noticed, I actually seen a Facebook post. A man said, well, matter of fact, it was here in Jacksonville too. This girl, she was trying to trick with a boy for some money, and he was like, "Yeah, but I'm hitting that pussy raw." And she, at first, she was hesitant, but then she was like, he was like, "I'm on the way," and she was just like, "Okay." So you inviting it, and that's okay with you, but how can you be okay with just jumping head first, tricking with somebody, and knowing these people have unprotected sex with other people? Because I'm quite sure if they willing and ready to have unprotected sex with you, they're willing and ready to have unprotected sex with everybody. Like, motherfuckers like that scare me. Like, people that be trying to give a bitch $800,000 and shit to give them some cooter cat free. So if you got to pay that much money, bitch, what you trying to spread? What you trying to give me, bitch? I don't want it. So it's just a lot of factors and stuff that it irritates me because people don't take care of themselves. And I'm the type of person, I like to go back to what I know. And it's a lot of other people that go back to what they know, but that don't necessarily mean you're safe, because that person could have had unprotected sex with somebody that's HIV positive. You know what I'm saying? And it don't necessarily mean you're gonna get it. It's people that has HIV, full blown AIDS, that has kids and has significant others, wives and stuff that don't have it. I don't know how that happened. I don't know if they were taking their meds.
That's the only way.
Yeah, if they were taking their meds or they were taking the PEP or the PrEP medications, so they can't get it. But it is ways around it. It is ways that you can be sexually active with someone that has it and not catch it. But it's a lot of people out here having unprotected sex, actually spreading it, not taking their medicines on purpose.
While you're on there, let's talk about how it is possible. So when you are dealing with a person who is HIV positive, they are able to get on their own medication regimen. Once they are on their own medication regimen for however long it requires, they are able to reach what is called a status of undetectable. What this means is all of those little mom and pop places that you can go get the HIV, it could possibly not show up on there. So you can't just take test records from people anymore.
No, you can't do that.
Also, you have to kind of know and be serious about it. And then on the flip side, if you are a HIV positive person and you have tested undetectable, and you are safe and you got your medication regimen and you sleep with another person who also has the virus and they're not on their regimen, it can mess your regimen up. So now you're back into starting over, finding a new viral medication load that can kind of get you back to that point, and you could possibly lose it. You possibly can become like, what is it called when you immune to what the medication could do for you, and then you're just going to be on all of these medications forever. So it's a lot of reasons why we should be safe and be cautious. It's a lot of just do your own research.
So is it, because a lot of people think, and I was looking at the message group and for real, because people be trying to expose people in the message group. And one thing that they were saying, like, you know how the tests have non-reactive and stuff like that on it? Somebody was trying to say, oh, it's a non-reactive, so that means they got it, but it's just not showing. Like, it's no way that you could tell if their numbers are undetected. They can take a test and the test say negative, and there's still no way that you could tell that they actually have it unless they come to you and tell you, unless you see a written document stating that this person is HIV/AIDS, positive, correct?
Okay, I want to make.
Okay.
So let me clear the air with that.
Okay.
So if you take a test and you are HIV positive, I don't care if you are undetectable in your viral load, you will still test positive on a rapid test.
Okay, you still can test positive.
Yes. There is no way for you to not test positive if you have the virus. That's just like if you had chicken pox. Okay, guess what? The chicken pox not active, but if you take a test for chicken pox, it's going to show that you have chicken pox.
So whether you're undetected or not, that test is still going to show
that
positive.
That test is still going to show positive.
But isn't it a possibility that it won't? 'Cause
there's no possibility that it will not show that you are positive. Okay. Now,
so have you ever came across
a blood test? Now that shows your viral load, and that's where the undetectable comes in, because now it's gonna show this is undetectable because your viral load is
but it's not going to say negative.
It's not going to say negative.
Okay.
So that's why it's important that couples, or if you're trying to get intimate with someone, that you go together to go get tested. And then once you go together, as a matter of fact, you don't even got to go in nowhere. You could buy your test. Go in Walgreens and buy you a test.
If for the motherfuckers that's scared to go get tested, go to Walgreens and buy you an HIV/AIDS test. Get tests. Check your numbers. Check your blood. Check your body.
They sell home kits.
Check your health.
Yeah, so you can order them because they do sell home kits.
Okay.
Also for STDs. Now they have rapid home kit tests for STDs. So they have them for gonorrhea, chlamydia, and syphilis.
Okay, but it's a lot of uncurable STDs as well. I think herpes, is it syphilis?
Herpes.
You got hepatitis. Which one?
So hepatitis, that's also a STD. That's another thing that we treat as well, and we test for. And so it is curable, but once you have the virus, that virus is always there. But it is curable and treatable.
Okay.
So basically, it's all in you going to get tested and knowing your status.
Okay, so another thing that I wanted to address, because listen, when I see things, I have a habit of responding to it. And listen, especially when it's about HIV/AIDS, I tag a motherfucker real quick. You know me. I tag you real quick because somebody somebody thought that men cannot give women HIV/AIDS.
Yeah,
I mean, it's low, but it still can happen. That's like saying that a man can't give a woman a STD, or a man can't give. I mean, come on
So
now.
first of all, it's more probable for men to spread it than it is for women,
Thank you.
because again, women are receiving.
Mhm.
So, and that's a open emphasis of where, guess what, we have blood and body fluids that transform from
Yes.
that area.
And also for anal, it's directly into.
I think it's
Exactly.
worse with anal, but
So-
I think that's why the majority of the percentage of the HIV numbers are, bisexual men and men that's having this anal sex. Now, everybody has it, but when I was doing my research, white women had the lowest percentage of HIV/AIDS rates. Black women had the majority. It was more prone in young people, from starting at ages 13 to like what, 27 or 37, something like that. Yeah,
So
the
you
numbers.
want to know why that is?
Why?
So the reason why is because, so when we had a high pregnancy rate.
Mhm.
So now young people don't have sex. They feel like if they have regular sex with vagina area, then now that increases their risk of pregnancy. So now they will do anal sex as their way of intercourse, and so that's why that rate
Because
is
they don't
higher.
know,
Because they don't know.
and it's good
Wow.
to actually know these things.
And so the pregnancy rate
Mhm.
has decreased in
Mhm.
teenage pregnancy,
Yep.
but the rate of STD infections have increased.
Mhm.
And so that is another reason why with PrEP, it starts at age 13.
Mhm.
And we also have recently started with injectable. So there's an injectable available for prevention as well that can be given every 2 months.
Okay, and that's good. It's good, but it's it's a lot of elders, and I could say at least 2 or 3 men here in Jacksonville that done been on the news for spreading it, and then they go to these young women. And the young women, they don't know to do their research. Only thing they're seeing is, oh, give them some money, and they offering these girls money, and the girls, they ain't even thinking about it. Like, oh, I give you an extra $500 to have unprotected sex, and bitch don't be thinking, bitch be walking around like, give me HIV. I'm sorry, but you know what I'm saying? Because they just see the money. Fuck the money. All money is not good money. Sometimes you got to learn how to say no. You know what I'm saying? And true enough, it's not always spread by sex. Some of these young people, they have it because their mom had it, their dad had it, they were born with it, and it's sad to say that they couldn't control it. They had no control over their life or what they did. It's just something that they were born with. But some of these parents, they're not even telling their kids that they're HIV positive. These kids have to know this before they get sexually active, and you don't always know. So at a timely manner where they can understand, you have to tell these kids. It's just crazy. Younger people going in the button out. Yes,
Yes.
younger people are going. Everybody. I mean, people have anal sex from young kids. From young kids to older kids. It's what they do, but it's a crazy world that we live in. It really is, and it saddens me. I get worked up off of shit like this because it's just too much. But we are top 5 in the city in the U.S.
No, so we are. So we're actually number 3 in the country.
Number 3 in the country.
So Jacksonville, Florida, is number 3 in the country in terms of HIV cases. So we're number 3 in the whole U.S. And then we're number 1 in the state of Florida of new cases.
Really?
Yes.
Really?
Yes.
Oh, they need to update this Google shit. They need to update this Google shit. They do, cause I'm talking about, I'm looking.
By the time it's posted, new stuff has already come
Yes,
in. Like,
yes.
you have to do the research, then post about it. By the time we see it from a news broadcast, that's already old news.
Correct.
Unfortunately, because you have to get the data, you have to do the test, you have to get all of that information, and people have to be going to the hospital, going to get checked
Tested.
up,
Tested.
Like, if you're, just because you don't go get tested, that doesn't mean out of sight, out of mind. You are still exposing yourself. You're still able to get everything else anybody else can get. Like, just because you don't go to the hospital, it doesn't hide it. You're just a part of the problem and spreading it.
Correct. So, I read, if it's 29,500 HIV cases in Florida, right? That's 58% of the population with HIV infection. That is more than half of the population that's infected. So it's like, bitch, when you walking out the door, bitch, I'm scared. Get back. Like, you just, that's more than half.
So that's why everybody should have their PEP in their medicine cabinet. So if you need it, you got it.
So is it something that you can get just on your own, like a prescription on your own of PEP? I only thought about it in the emergency room, but is it something that they can go out and purchase? Like, you know,
so it's not over the counter, but it's just like Plan B, where they can come in to my clinic. They can go to First Coast. They can go to AHF. They can go to CAN. Take a rapid test. You don't even have to be tested. If you know that you are negative, then you can have your emergency prep to put into your medicine cabinet. So it's not necessary to get tested until you have to pop that top.
Okay. I was going to ask, is there, does it lose any effectiveness by having to take it more often? Or if you had to take it today, and then in a couple months you had to take it again, and then in a couple months you had to take, like, is there a
or immune?
Once you pop the top, you got to take the full course of it. So it's not like, oh, I'm gonna take a few pills.
Oh, no.
Not
So like that, meaning if you've had multiple occasions where you've just had to take PEP prior to. I'm not talking about PrEP that you take every day, guys. I'm saying if I was to come get that preventative 72-hour exposure PEP, is there kind of any way that I could become immune to the effects of the medication?
There has not been any tests or studies saying that, hey, you're going to be immune, or it increases your chances of being. Actually, the numbers are so high, it's like 99% chance that you're unlikely to be able to contract HIV.
I would like to add this. You can go to your primary care physician and let them know that you have been exposed, or either that you know someone that has been exposed, or, you know, have it, or you want to see them, so that you can get either PEP or PrEP. And, you know, I'm nosy and I like to ask questions. So I'm sitting in a doctor's office and I'm like, hey, you know what I'm saying? Do you have people in here that has, you know, HIV? Like, how do y'all handle it? And she said, yeah, I do have somebody. She say, this lady, she came in, she's HIV positive, and she wants to deal with this man, but he doesn't have it. And she wanted, you know, to get her medication and stuff so she could start seeing the man and you know, doing it. So she said they actually started doing it, and she said the lady actually had a baby. The baby does not have it, and he does not have it. But, you know what I'm saying, it's amazing what you come across and the things that happen, because if you don't do your research and you don't know these things, it's like, yeah, like, bitch, this is real life. Shit like this is happening for real. And you don't motherfucking know it.
And
so
the technical term for that's called serodiscordant couples. So there's a whole study and research information on that, where you get, like, that's always been a thing. That's not anything new. That was even before medication been as innovative as it is now, there's always been serodiscordant couples where one person is positive and the other person is negative. And it's always been too that if a pregnant mom is being treated, then more than likely the baby, when the baby is born, it will convert over to negative and not become positive. And so that was one of the reasons why they implemented the law for every pregnant woman to be tested for HIV. So then once they know that that mom is positive, they could go ahead get her on the treatment to ensure that the
So the
child
baby won't have
did
it.
not convert over.
Right. So is it a way that you can actually be pregnant and the doctors not catch it to prevent the mother from giving it to her child?
There's not a way of that because, like I said, by law now, if you are pregnant, they're going to test you for HIV.
Okay, good. That's
but
good.
in the past, like how you're talking about, there are children that came about that have HIV.
Yep.
Well, they weren't being tested, and
Yep.
so they were pregnant and born, and they weren't treated, and so now those children did not convert.
Yeah, I listen.
negative.
I never forget. My cousin, she had a best friend. She stayed out there in Roosevelt Apartments. I think I was like 10 or 11, but her friend was having sex. She had like 7 kids. Her friend was having sex. The baby daddies was dying. She must have been like the host or something, cause the carrier, the baby daddies was dying, and damn, the baby was sick, and you know I was like, well, mama, why the baby sick? And I think the baby ended up dying. I'm like, mama, why the baby died? She like, well, you know, they was sick. They had, you know, AIDS, and the baby got it. And now you sitting your big grown ass up here living your motherfucking life, and these men dead, and this motherfucking baby dying in a hospital, hurting, and you know what I'm saying? Like, it's hurtful. It's really hurtful to just. People just, I don't know what the fuck wrong with people. But can y'all tell these people where they can go get tested and treated again so they'll know why the live is on? Because y'all need to go get tested. And if you got that shit, you need to go get some medicine. And make sure the people you fucking got the medicine that they need. Yeah.
Facts.
Yeah. And I don't know why this shit keep going in and out. But when it come back, I need you to tell the people right quick before I close out this motherfucker. Yes.
So definitely the health department.
Health department.
The health department always is a go-to access. Free, don't cost you a thing. Then again, like I said, AHF, CAN, First Coast Community Development. I do know also Crossroads. So there's several different places, but also to your primary care providers. I am also myself looking for providers that's in the state of Florida and in the state of Georgia, where we can connect with them to actually have them add STD prevention to their practices, and then be able to provide them with the services of provide and the prevention for PrEP, also for hepatitis C with Epclusa. So definitely, like, I'm located at 6015 Chester Circle. First Coast Community Development is 525 North Noonan Street. Right downtown, so
Boss
very
bitch.
Convenient. And then we do telehealth, so it's no excuses.
No excuses.
Like, so no excuses. We also will mail you your PrEP kit. So if you want to get your kit, we also have some people that are out in the side of the community. They're going to in different neighborhoods because we know the zip codes that's hot. So we're out, boots on the ground, going to different.
What zip codes are
areas.
hot? Can you say that? No. We need to know what zip codes is hot.
So the hot zip codes is where all of us live, all of us black and brown people. So that's gonna be your
32202, 32208, 32209,
yes,
32206.
32254. So all of the areas where us black and brown people live and love.
It's
that
fucked
is
up. We
considered the
killing
hot
each other with
zone.
guns and with sex.
The block is hot.
The Did y'all just say that at
The
the
block
same
is
time?
hot, baby.
They said the block is hot at the same
No, I
time.
said that. No.
The block is hot. Hey, the
Y'all outside and y'all ain't protecting y'allself.
we gotta stay protected, y'all. So listen, we discussed it. HIV/AIDS awareness. Go get your tests. Go get tested. You know, take your medicine if you got it. If you got it and you want to fuck with somebody, let them take some medicine. Let them know before you start fucking. Check the news. Check the nigga first and last name. Check news for jacks, cause them niggas that be getting exposed, they be on news for jacks, and they already be done had a record, and y'all just be fucking. But anywho, just remember y'all heard it here on Hearsay Table Talk, where we gonna talk about awareness, uplifting, motivation, drama tea, all that shit, bitch. Cause yeah, the people need to know, and we gonna give them to a blood raw. Okay, have a good day. Nasty bitches. What, Joe?
You was dry a little bit. But this was.
Yeah, well, you know, I this a serious matter, so it's okay to be dry for the occasion.
No, this wasn't dry.
Oh, okay,
This, like, before it was like, before we, this was good.
okay.
Okay.
You can't exactly